We are very excited to welcome you to HCU Network America's inaugural conference and taking lead for HCU. So at this time, we're just going to introduce our board and go from there. The first person I'd like to introduce you to is Margie McGlynn, our president and founder.
Here's a mic.
Oh.
Emmanuel, don't we have a wireless mic we can pass along here?
I don't think they...
Oh, here it comes. Okay. Thank you. As you can tell, we did a dress rehearsal. Just kidding. So I'm Margie McGlynn, as Danae said, and I'm a co-founder of HCU Network America, along with Danae, and then Kristen, who will introduce herself. We set up this organization, and we're so pleased that you're able to be here today. And I'm involved in HCU as I had two sisters who I lost to HCU in the 1970s. So you'll hear a little bit more about that tomorrow when I talk about the research that we've been supporting. But we've been planning this meeting really since we came together as an organization about 18 months ago. We really just got our 501c3 status in October of 2016. And Danae, who has a lot of experience with PKU and helping out that patient support group, said, okay, when are we going to have our first meeting? Because we know the way we can best provide value to all of you is if we're able to help provide a lot of information and resources on the disease to make it easier for you as patients or as caregivers to manage the disease. But we also know, as I said in my welcome letter, that a real benefit that comes from meetings like this is the interaction you all have with each other. So we really want you to maximize the value of that over the next 2 days, get to know each other, share what works for you, and leave this meeting, armed with really all the benefits of that and that camaraderie that comes out of, having a shared issue that you help each other to manage. So we hope we're successful with that at this meeting. And again, we're very pleased that you are able to be here. And I do want to just recognize Danae at the beginning. She has worked so hard to pull all of this together and to do so when you're 7 months pregnant. We all, those of us who have been through having a child or spouses of those having a child know how tiring that whole time period can be, and she has just exhausted herself day after day, including yesterday, to get ready for this. So thank you, Danae.
Hello, hi. I'm Kristen Rapp. I am both a patient and an advocate part of this board. I was diagnosed through newborn screening as an infant. I'm also known in the community as the Marathon Girl. I've participated in a number of marathons 4 times here in Boston in raising awareness for a rare disease. I'm very happy to be here, and if you have any questions, please come up and see me.
So I'm Kim Chapman, and I'm one of the board directors, but I'm also a physician scientist. And so my expertise is guidelines in addition to clinical management of the homocystinuria. So I'm really pleased to be invited to talk to you all. I really enjoy talking to patients. It's one of the things that I enjoy a lot. And I am going to kind of talk about some of the clinical guidelines. There's always controversy in terms of treatment, so people do different things. I'm just one of the experts. There's several others that you'll see potentially as we go along. So Harvey Levy will be here tomorrow, and I suspect many of you know Harvey, who is one of the fathers of metabolic disease. One of the things to know about me is I'm a little different than a typical metabolist and geneticist. You may have noticed that behind my name, I have what's known as degree bingo. I am not just a pediatrician who takes care of people with genetic and metabolic disorders. I'm also an internist who takes care of people with genetic and metabolic disorders. So sometimes my perspective can be a little bit different than some of the pediatricians.
Oh, and I'll just say Dr. Harvey Levy from Boston Children's will be here tomorrow, and we'll formally introduce him at that time.
This just might be easier to do one microphone. All right. And then we do have 2 medical advisors. Kim Chapman is actually one of our medical advisors in addition. But we have John Fachichi Ulu with Children's Hospital of Philadelphia. And we have James Weisfield Adams. James passed away last month. He was an amazing doctor, advocate, all-around person. He was centered at Children's Hospital of Colorado. Like I said, he was a great champion for patients with homocystinuria and cobalamin-related disorders. He passed away at home with his family after a courageous battle with 2 devastating illnesses. He was an attending clinical and metabolic geneticist at the Children's Hospital of Colorado. So we just wanted to recognize him and just take a moment. It's a big loss. So.